breaking the story. Brian.
Beamer, you know, every day the Audie Murphy VA hospital here is swamped with veterans trying to get medical attention. But our investigation found that some of those vets aren't even surviving the battle to get that care.
The promise Uncle Sam makes its soldiers is simple. Fight for your country, and for the rest of your life, we'll take care of you if you're wounded or get sick. 32-year-old Michael Franklin counted on that promise. But he didn't die while serving during the Gulf War. Instead, he died right here at home after he could not get in to see a doctor at the VA hospital.
He was a very loving individual. You know, he always tried to help people.
Michael's father says his son changed when he was diagnosed with bipolar disorder.
Well, he just kind of like gave up on life. You know, he just kind of gave up.
Michael was being treated here at Audie Murphy Medical Center. But one day in 2004, he told his father he was not feeling well.
He had bad vomiting, diarrhea, loss of vision. He couldn't even see across the room. He needed acute care. He needed it right away.
So his dad dropped him off at the VA.
Michael sat in the waiting room at Audie Murphy for 7 hours without being seen by a doctor. The next day he went back, and this time he waited 8 hours. Again, no doctor.
The doctors, as far as I can tell, nobody ever saw him. There is a doctor that signed off on his chart the first day, but she never actually saw him.
The next day, Michael's father found him dead. An autopsy later showed Michael had a reaction to his bipolar medication that could have easily been treated. Instead, his father says he was ignored to death.
He didn't receive the care that he should have gotten and the support. You know, he just didn't get it. He fell through the crack, maybe like a lot of other veterans do over there.
Michael's father thinks of those other veterans when he visits his son's grave every week at Fort Sam. He also filed a lawsuit in hopes the VA would make changes so this would never happen again. The government recently settled the case for an undisclosed amount of money. But Michael Franklin is not alone. Our investigation uncovered records detailing dozens of claims of injuries and even deaths reported by veterans and their families at Audie Murphy and other South Texas VA facilities since 2005, including a veteran left a quadriplegic after a spinal cord injection went wrong. Another vet got sick and died after getting pressure sores from not being moved after surgery. Several vets claim they were not told they had cancer until months after the test revealed the deadly disease, and it was too late. Another vet got sick after surgery because a doctor left a sponge in his body.
We do our best to not have, of course, substandard of care.
The VA will not comment on any specific cases, citing patient confidentiality, but a spokesperson admits they need to do better.
Substandard care should not happen to any veteran throughout the VA and here at South Texas, but we recognize it may happen.
And when it does happen, the VA says it takes steps to discipline the employees responsible and change any procedures to make sure it does not happen again.
Most importantly, we talk with the family members. We have our director speak with the family members, apologize, be compassionate about what they're going through.
But Gayla Smith says she's still waiting for her apology for the death of her husband, Robert, a father of 3.
And we miss him so much.
Robert Smith was a Vietnam veteran, diagnosed with Lou Gehrig disease. But it was not the disease that killed him.
This was a tragic accident that never should have happened.
Smith died at Audie Murphy after being accidentally disconnected from a ventilator in 2004. His medical records show it was unplugged for 3 to 5 minutes, leaving Gayla with unanswered questions.
The alarms that sounded on his ventilator at home were so loud I didn't understand how anybody could fail to hear them. That if the equipment was faulty and it didn't sound, then it needed to be fixed.
And a lot of veterans and their families think it's the VA system itself that also needs to be fixed.
There are so many things that veterans have to go, that our men have to go through to get help. And they are heroes, and they deserve the best we can give them.
Gayla Smith filed a wrongful death claim against the VA on behalf of her husband, but that claim was denied. She tells me she would like to file a lawsuit to try to see if that would force the VA to take better care of veterans, but she says she simply doesn't have the money to do that. I'm News 4 WOAI troubleshooter Brian Collister.
All right, thanks, Brian. These kinds of mistakes can happen for any number of reasons, including an ever-growing number of veterans, not enough funding, And also that the VA is a teaching facility for new doctors who may be prone to make more mistakes. But again, the VA says it is taking steps to improve the health care here as well as at other facilities. If you would like to share your VA story or check out others, you can head to WOAI.com. You click on News 4, then find our blog in the Beyond the Headlines section.
Tonight, News